Welcome back, everyone. We have a special guest with us here at 5 o'clock today, and it's Dr. Chris Haddad from Shannon Medical Center. We welcome you.
Thank you. Thanks for having me.
So we're here for a discussion on heart attacks. You're going to talk to us about being a heart doctor, heart specialist. So I guess it's, you think of heart attacks, you think of cancer, those are kind of the major two, it seems like, that affect most people. So tell me your experience with heart attacks.
Well, it's true. I'm glad you brought that point up. The number one killer of Americans is heart disease by far and away. And it's interesting when you look at the statistics, most Americans don't realize that heart disease usually takes, in most statistics, 1 in 5 Americans' life every year. And coronary artery disease, or heart attacks, is the big leader in that group. So, unfortunately, this is still a very prevalent disease. We've had different treatment modalities that have let us improve the numbers, but it's still overwhelmingly the largest killer of Americans in this country.
And that's for men and women.
Men and women.
Signs and symptoms, what should we be looking for?
So a heart attack's a big term, and so we get the movie version, but the most common symptoms we have when people have what we call heart attacks or these acute coronary syndromes is where a plaque that takes time to develop, and that development happens over years. But what happens in a heart attack is that plaque becomes unstable. There's different theories of why that happens. But basically, the plaque, which is made of a sort of fatty core and a fibrous sort of plaque or cap on it, it ruptures inside the artery. And then a whole cascade of events happen, and there's lack of blood flow to that portion of the heart by whatever artery is involved. The most common symptoms are usually people describe tightness or heaviness in their chest, sometimes pain up in their jaw, pain sometimes referred to the left upper extremity, sweating, lightheadedness, dizziness. Those are the most common symptoms we see when people have heart attacks.
Okay, and with medical advancements being what they are, I'm sure there are new and improved ways to treat something like that.
The standard of care in, relatively short period of time compared to, the scope of medicine has been revascularization or opening that artery. So our goal is to get blood back to that part of the heart as quick as we can. So those strategies really have been pioneered with catheter-based strategies or balloons and stents. So the way we've treated these have radically changed over the last 50 years, over the last 30 years. So here we've set up a network. You can imagine where we are in San Angelo. We have San Angelo, but a very big percentage of our heart attacks come from around our region. Mm-hmm. So in a lot of cases, we're giving drugs that start to break up those clots that are formed, and then they come or get to Shannon, and we go straight to the cardiac cath lab, or we go urgently to the catheterization lab where we open up those arteries to get blood back to the heart.
Okay, got about 30 seconds. Talk about prevention. Let's not have a heart attack.
The most important thing is not seeing me in the hospital or in the cath lab, but seeing me in my office. That's what I tell people. So the big risk factors: smoking, diabetes, high blood pressure, high cholesterol. All of those are preventable. So a lot of series estimate that we can reduce the risk of heart disease and heart attacks by a huge percentage by getting on top of those risk factors. So medicines that control our blood pressure, our cholesterol, it's first knowing those numbers, seeing our physicians, and then adequately treating them to have those risk factors controlled. That will help us prevent heart disease.
All right. Doctor, thank you very much.
Appreciate your time.
All right. Appreciate you.
Thanks.